So let's get the recording started. All right. Well, good afternoon, everybody. It's Friday. I just wanted to let me get this person admitted here. My name is Travis Riker with Arista Consulting Group. We are your employee benefits broker, and we'll be walking through your enrollment options for the coming year. If you could, just keep your phone on mute unless you have a question. I'm going to show you a couple different things today. Open enrollment is that period of time that we can go in and make changes, add people, delete people, look at one benefit versus the other. And so we're going to take a minute to just kind of review some of the highlights this year, kind of what's changing and what's not, and then how to enroll. I'm also going to spend some time on your benefits website, which is a great tool that allows you to have everything at your fingertips. So we're going to be using the benefits guide primarily today as the vehicle for the conversation, but I do want to also navigate to the website as well. On page 2 of your benefits guide is just kind of a table of contents that gives you the high-level overview of what we're going to be doing and where you can come back should you want access to information somewhere down the road. We're going to move on to page 3. This is kind of what's new for 2022. So we have a number of really positive changes we want to talk about in terms of how we make health insurance and healthcare easier for you and provide you with more tools. We do have several cost savings programs we're going to go through here in a second to provide better care. And I've already spoke to a couple people that were really excited about this. But we'll also be going from 3 medical plans to 2 medical plans starting July 1st. All of the changes in this guide today will go into effect July 1st, 2022 and end June 30th, 2023. Also, one more important note, if you are currently enrolled in healthcare, your ID card works, but part of the Consolidated Appropriations Act, which was one of the federal laws that was put into place not that long ago, required some health insurance companies to do some additional things on the back of ID cards. So everybody will be getting a new ID card. You're physically not going to likely see that ID card until about midway through July, but you can get on the Meritain website and be able to get a copy. We're going to get all the file to them right there on July 1st. So very quickly after that, you should see the ID cards and have all that information kind of at your fingertips, if you will. Let me just let some more folks in here. All right. All right, so let's talk about some of these cost reduction programs. So the first is the Livongo Diabetes Management Program. For those of you that this might apply to, if you've dealt with anyone with diabetes, it can be a costly and cumbersome process. And what we're offering to the employees of United is extra support, extra coaching, a cellular meter for real-time feedback on glucose readings, and unlimited test strips at no cost to you. So we want to remove any financial barriers to taking care of your diabetes, as well as providing you the conditional care management and treatment that you might need. The second is the high-cost drug management program. And for those that don't qualify for necessarily for case management, but are utilizing injectables or maybe home infusion for very expensive programs, this program provides treatment, provides education to kind of help you navigate the complex environment of healthcare. And so again, this is at no cost to you. The next is a program called Prudent RX. And again, there's nothing to really think through or have to write down. They'll be reaching out to you if this applies to you. They certainly would be aware. But if you have a need for specialty medications for autoimmune disorders or multiple sclerosis, oncology, there's an ability to get significant savings on the cost of those medications when it's dispensed through CVS. So just kind of, if that applies to you, just know that there's an opportunity to potentially change locations and see what the cost difference would be. It could save you and the organization a tremendous amount of money. The last thing, we've been really focused on expanding access to care. We want to make healthcare more simplistic than it currently is because it's pretty complicated. And one of the benefits of working with Meritain, who's owned by CVS and Aetna, is that they have access to the retail clinics called CVS Minute Clinics. Well, if you're on the what now is called the base plan or the $5,000 deductible option, it is simply a $15 copay. So we've made it very easy to go to the Minute clinics. If you are on a high deductible health plan, the copay is available once the deductible has been met. That's not something that Arista or I or United Consulting or Meritain is even doing to you. It's just part of the IRS rules that in a high deductible health plan, all expenses have to go to your deductible first. And then if you want to locate Minute clinics, certainly you probably know, but you can get on CVS's website and find them. And then the last thing is regarding maintenance medications. We have an opportunity to get the prescriptions filled at the pharmacy or through mail order. So you have two options. However, there's an opportunity to save both time and money by not having to physically go to the pharmacy, let alone the price of gas that we currently have or the time that it takes to get there. You can get a 90-day supply for only 2 retail copays instead of 3, right? Each 30-day supply is a copay amount. Now it's only cut down to 2. And then lastly, your HSA limits, if that applies to you, have increased, and there's a page on that. Also new for 2022, starting July 1st, is we're moving from Unum to MetLife for the basic life that the company pays for. The company paid short-term and long-term disability, voluntary life, and then dental and vision. You're going to see some great enhancements and lower costs associated with this. What's staying the same? Your HSA is still with Health Equity. If you have any questions, you'll see in the enrollment system, it says to contact the accounting or HR team. There is a process that you have to go through to set up your HSA accounts for those of you that this might apply to. But each year the limits go up. So these are the newest limits. You also have access to telehealth through Teladoc. A variety of minor conditions can be done via video chat. And certainly what you've seen with healthcare, or I'm sorry, COVID, is telehealth being a lot more prevalent. People don't want to go to a doctor's office or don't feel comfortable or just want to start with something. So you have access, if you're on that $5,000 deductible plan as an option, it's at no cost to you. So we're going to talk about kind of triaging where should you go first in just a second. And then we're going to spend some time on Healthcare Blue Book. We want to make sure that we are reimagining healthcare. Healthcare is very complicated. And one of the things we found is that, you know, as an example, Edmunds changed the car industry. People didn't know how to buy a car or how much things cost. And now we just get on the internet and we know exactly what things cost. And shoot, we don't even have to go to a dealership anymore. We can just buy a car online and it's delivered to our homes. But healthcare still is kind of complicated. It's very difficult to find out what the price is in advance. And so this is a really easy tool, and I'll give you some examples later on about how you can put money back in your pocket and save money by just engaging with a couple clicks of your fingers or a mouse to make decisions easier on things like MRIs, colonoscopies, and other things. Then lastly, the voluntary accident and critical illness are not changing either. Earlier this morning, you would have got a first email from Employee Navigator saying that the system is ready for you to go enroll. However, we've been helping a lot of people today, and I just want to give you a couple of things. It is very important. You must click on the register link first. And we sent a second email from HR today. You must click on the registration link first, put in the new company code, your name, information, and then it's going to take you to a second screen for you to set up a username and a password. Please make sure to follow those directions precisely, including the character requirements of the email. If you do that, you should not have any problems. When you go into the system, though, we talked about going from 3 plans to 2 on medical. If you're in the HSA $2,800 deductible, nothing is changing on that plan, and you're just going to be rolled over into that plan if you have that today. If you are enrolled in the $1,500 deductible option, we're going to be moving you to the $5,000 copay plan, which is a new plan that has copays, which you didn't have in the past. But you can absolutely go into Employee Navigator and make any changes that you'd like between today and then open enrollment closes on Wednesday at 5 p.m. We do need to shut the system down to get your information over to the insurance companies to get you well taken care of. If you have any questions, you can email us at help@aristacg.com or at this telephone number here. The next page just talks about your eligibility, what the company pays for, the benefits that you can enroll in as you go on through the year, what a qualified dependent is, etc. The only other exception, like this is the time open enrollment to make any decisions on our benefits. If between now and Wednesday at 5 p.m. you want to make any changes, you can. There's no questions asked. You can kind of add a spouse to medical, just have employee-only dental, whatever it might be. Outside of open enrollment, which closes again on Wednesday at 5, the only time you can make a change based on the IRS is something called a qualified life event. You get married, you get divorced, you have the adoption or the birth of a new child. Those allow you to be exceptions to the normal rule, and you could go back into the system with HR and make changes. This just briefly describes that. Let's take a quick look at your medical benefits. Again, the HSA compatible plan is here in the middle. It says $2,800 on page 7. And what you're going to find is the way these programs were designed several years ago was to promote consumerism or to take more ownership of your health. Those were the ideas behind it. And so what happens is all of your services, if you go to the primary care doctor, specialist, pharmacy, tests, labs, surgeries, whatever it is, you must meet the deductible of $2,800 for an individual or $5,600 for family first. So if, for example, a primary care doctor, you go in for a strep throat and the doctor says the negotiated price is $115, then you pay the full $115 until you get to the $2,800 deductible on that plan. It is different on the next plan. But just to keep it simple, all services, regardless of what you do, have to go to the deductible first. And then it is either, as this section says, 100% covered, or there are just copays for prescriptions. Over to the right, this is the new plan. We've taken the same deductible of $5,000, $10,000, but we wanted to remove the barriers of having to have an HSA pay for it. We wanted the ability for people just to go to the primary care doctor and pay a flat $25, or a specialist and pay a flat $50, or urgent care, $75, emergency room, $500, versus if the cost of an emergency visit was $1,800, under this plan, the $2,800 deductible, you pay the full $1,800. Under this plan, it would be $500. Also on the pharmacy, you don't have to meet the deductible. You can just have copays. So it might be $10, $35, or $60. And so, you have the ability to choose any plan you want. This plan is a little bit richer in terms of how it typically pays for most people. So it's a little bit more money out of your paycheck. And here is the cost of the $5,000 deductible option. Pharmacy benefits still continue with Meritain. You just go to their website and everything you might need to do is right there. There's the mail order program where your prescriptions fall in the formulary, which is just, which tier they are. But I want to take just a few minutes to just kind of do a teaching lesson and something that I've just learned over the last 20 years that I think will help you. This next page on page 9, think of this as kind of the triage system. We've talked about Teladoc. Teladoc is like, allergies, headaches, colds, cough. It's easy for us to sit in our couch, open up the application or a telephone number and ask Teladoc to do a visit. These are board certified doctors. I've used it myself this past year when I had a sore throat. I took a picture, I did a call, I never left the house. It was 8 p.m. He said, I think you're fine. Let's give it another couple days. If that doesn't do it, then call us back and we'll get you a prescription. Turns out he was right. I never had to go to the doctor. I didn't have to leave work. If this was one of your children, you didn't have to take them out of school, pay for the parking. We've also made enhancements to the next one, which is the retail health clinics. If you go to CVS now, let's just use the $5,000 deductible. It's $0 for Teladoc. It's only $15 flat copay for retail. Primary care doctors $25, urgent care is $75, and ER is $500. So think of this as the least expensive at the top and the most convenient to you, all the way to the most expensive and the least convenient for you. So it just pays to kind of know what you're going to do. Next, I want to just take an opportunity to teach you 2 things about healthcare. Healthcare is the only industry where we don't ask for the price of something up front. Now, can you imagine a situation where you went to Kroger today, you picked up a gallon of milk at Kroger, and 2 weeks later, Kroger sent you a bill for $25 for a gallon of milk. That seems preposterous, because it is. But the reality is we do that with our healthcare every day. And we don't exactly know which doctor or which facility is better than the other. And so one of the things I want to teach you is when you are sick, you are anxious, you don't feel good, you're probably irritable, and you tend to not slow down and make good decisions. So my first tip is to slow down. Just doing what is most convenient for you is more than likely going to be the most expensive. Let me provide an example in just a second. The second, outside of slowing down, is where you go matters. Now, for my example, I have an old college soccer injury in my right knee. I needed to get an MRI so the doctor could see it. I go to a Piedmont facility here in Atlanta doctor. They recommended, hey, just go down the hallway or you can go across the street and you can get an MRI there. Well, that was going to cost me over $2,500. And MRIs go towards your deductible. And who pays for your deductible? You do. The deductible is paid by you, and you're in a situation where you can either go to where your doctor tells you to, or in my case, I actually found Roswell Open Imaging as an example, and that same MRI cost me $400. The $400 is certainly a lot less out of my pocket than $2,500, and to make this even easier for you, you access to a tool called Healthcare Blue Book on my screen. You can download a free app and you can sit there with your doctor or before you even go. And for example, I didn't have this tool. I can literally type in that I needed a MRI on my knee and it will tell me within a zip code. You type in your zip code or where you are and it will tell you a green, yellow, or red provider. Green means good. Green also means, to make matters even better, that that money that I paid out of my paycheck for my MRI, you actually could get $100 credit or a credit back to you by engaging a green provider. So not only is it going to cost you less because you're being smart, but United is going to pay you from Healthcare Blue Book, so you have access to being more efficient. These are the instructions on how to look at it on an iPhone or the Android device. All you need to do when I just worked with Reza today. I won't give any specifics, but he said he was comfortable me sharing the story. He needed to get a scan done just for something to make sure everything was just fine. And one place that he was told to go to is over $6,000 for that scan. Another place was as little as $2,000. We just got on the app today, quickly loaded it on his phone, and said that the average fare price was a little over $450. The app told him exactly where he could go, where the green providers were, and not only was it going to cost him, if he so chooses to do this, less money, but he gets a check. So this is just real world. We shouldn't always just do what our doctors tell us to do. And I do not mean that doctors have any malicious intent. That is not what I'm trying to imply. But most of the doctors' practices are affiliated with a hospital or a larger system, and they're supposed to keep it in the family. So they're going to give you referrals to the Piedmont imaging facility. Or if you're in Wellstar, the Wellstar. You need to do a little extra homework, slow down, lesson 1, where you go matters. Just open up this application and it'll help you make a good decision, okay? This is more information on Teladoc. This is more information on the health savings account. The health savings account is only available for the $2,800 deductible plan. There was a question earlier today as to why. It's because you cannot have first dollar benefits. The $5,000 deductible has copays. So it's not eligible for an HSA effective 7/1. Only a plan that has everything going towards the deductible can you use an HSA. These are the limits. These are just some key highlights on how it works. Go ahead. Yes, if you were on the HSA plan, you would have a $2,800 deductible. Once you meet the $2,800 deductible, the insurance would start paying 100%, with the exception of pharmacies, which just turn into copays.
If you have the $5,000 deductible?
If you have the $5,000 deductible, Your primary care doctor visits, your specialists, your urgent care, and your prescriptions are just a flat dollar copay. The only thing that goes towards your deductible are things like inpatient hospitalization and outpatient surgery, tests like a CT scan or an MRI. Those would also go towards that. If you have an HSA now and you want to switch to the $5,000 deductible option, you don't lose any of that money. You just can't put new money in it. Okay, so you don't ever lose an HSA. That is always yours to keep. You just can't put new money in it unless you stay in the $2,800 deductible. Okay, good question. Here's a little worksheet if you're not sure how much you might want to put away and you're not sure what your expenses would be. There's a little worksheet for you. Some exciting enhancements that we've made. The life insurance, the company continues to pay 2 times your salary to $50,000. This is now through MetLife instead of Unum. And then there's a fantastic new benefit with voluntary term life insurance. Oftentimes we don't have enough life insurance. And a lot of people are like, well, how much should I have? If you listen to Susie Orman or Dave Ramsey or Crown Financial Ministries or other financial planners, the general answer is 5 to 10 times your salary. Very general, okay? Someone like myself, age 44, with a wife and 2 young kids, all in elementary school or now middle school, I'm going to be on the higher end. If you are young with no ambition to have kids or a spouse, you don't need that much. If you're at the end of your working career with no mortgage payment, no grown kids and no responsibilities, you're going to need less. But the general rule of thumb is somewhere in that amount. What's exciting is that employees can get up to 5 times their salary to no more than $500,000, the lesser of. And you can get, this is very important, $150,000 guaranteed. Does not matter if you have cancer or a condition or a pre-existing condition, you are guaranteed that amount. However, you are only guaranteed this opportunity as an existing employee between now and Wednesday at 5 o'clock. After that, only new hires have an opportunity within their first 30 days of being, eligible for benefits to have the guaranteed limits. If you have access to a spouse or child coverage, if you're an existing employee, existing employees, if you have it now, any of your amounts are just carried forward with no issues. But if you want to buy spouse coverage or child coverage for the first time, you would need to provide something called evidence of insurability or just medical questions. You can just reach out to us and we can tell you exactly what to do. If you are a new hire, as long as you're within your 30 days as a new hire, you can get the 25,000 spouse or 10,000 child guaranteed. Another awesome benefit is disability income protection. It's got a bit of a misnomer to it. This benefit is provided at no cost to you. So United Consulting Group pays 100% of it, and really think of this as paycheck protection. If you get sick or injured, for some short period of time, you have your paid time off or sick leave, but that's going to go out. And you don't have the ability just to continue getting a paycheck if you're not working for an extended period of time in most situations. So the intention of disability insurance, short term, is what it sounds like. You would have a 30-day waiting period for an accident or an illness, and it would pay 60% of your weekly income up to a 22 weeks period of time. That's a total of 6 months. If for some reason you still were unable to work, it would then move over to long term, and you would have 60% of your income on a monthly basis. And it goes all the way to Social Security normal retirement age, so up to that length of period of time, depending on your condition. And that's different for someone who's 25 versus someone who's 65. So that's the benefits that we have there. Terrific benefits that the company pays for. We just don't see all of our clients paying for all of this every time. So it's a really nice extra income in your paycheck of your total compensation and rewards. The dental plan is changing from Unum to MetLife. They're the world's largest, and so we expect this to be really good news. We have some plan enhancements, and it's costing you a little bit less out of your paycheck. So it tells you about the highlights up top, the network right there at the top, how to look at your providers. Your benefits are exactly the same with the exception of the annual benefit max. It's a little bit higher because MetLife puts like a little kicker. They don't have rollover benefits on unused amounts, but they do allow you to have a slightly elevated limit. So it's going to continue to pay, basic services at 100% of the cost if you stay in network. 80% of the cost is paid by insurance if you do basic like fillings, periodontics, surgeries, and then something more major, it's 50-50. Now, if you go out of network, which is more common in dental insurance, they look at what they say, what a 90th percentile of the dentist charge in a particular area. So for example, my dentist charged me $120 for cleaning, but MetLife says, well, most people only charge $110. I'm responsible for paying $10, if that makes sense. You're responsible for paying whatever difference upon that. If you go in network, you're simply getting 100% of that paid for a preventive exam. The orthodontia is also included for children up to age 19 at 50% up to $1,500. And then your payroll deductions are here. Vision is also moving to MetLife. You can look up your providers here or call them. And the one thing I would share with you on vision insurance, and by the way, this is the fourth benefit that is 100% employer paid. So even if you don't take any of the other benefits, they pay for this for you. I tell people, there's so many good reasons why you would have vision insurance. I've been the benefactor of dental. They found an issue in the back of my mouth that I had to get checked by an ENT. It could have been cancerous. It was not, but that was simply by going to a dentist. The same is actually true for vision. And this unfortunately happened during COVID for me too. I had a little flare up where my eyes got cloudy. I had an ulcer in my eye. Had I not gone to a vision provider, I could have been blind. I could have lost my vision. It could have done something more serious. Also, some people may not know this. They can look, when they're looking very closely with those special lenses, they can see in the back of your eyes. They can have early detection of a lot of different conditions, diabetes being one of them, just by simply looking at your eye health. So take advantage of that. Go in network. It's a $10 copay for an exam. If you have glasses, and someone here in the room does, it's if you go in network, it's $120 allowance and 20% discount over top of that. Now, some of you might say, well, I like my own vision doctor. I'm going to go to them. That's fine, but get your prescription, then go in network for your materials, your contacts, your glasses, your lenses, because it's only $10 copay after that. So again, this is an employer paid benefit. Also, what's happening during the COVID times is, some behavioral health or mental health issues have really kind of crept up and been more prevalent. And some people are just looking for help. And so certainly your medical benefits provide access to those assistance, but also we have employee assistance programs. Everything from just, grieving issues, whether it be a divorce, caring for an elderly parent, all the way to money issues, some basic legal services, identity theft, any number of things. This is completely confidential, tells you exactly how to register. You can call, you can get on an app. We don't get any kind of reports. No one here gets any kinds of reports. It's just a great way to get help if you need someone to talk to. And then lastly, the accident and critical illness benefits with Unum are unchanged. These are what I call luxury benefits. The things that are going to financially devastate you are not having health care. Your family would be devastated if they didn't have life insurance for planning purposes, if you didn't have disability insurance, but most of you are going to have those things. Outside of that, the last thing you're really looking to do is protect your retirement and saving that nest egg. All these other benefits are really kind of what we call luxury or nice to haves. Dental and vision. Most people haven't gone bankrupt due to a dental procedure or not having glasses. Doesn't mean they're not important. It's just that they're secondary importance to major medical insurance. Some people also like to take that a step further and say, okay, I've got a big deductible and I don't have the money if something happens to take care of that. So I need some type of supplement to take care of that. And so accident insurance does just that. If you have some type of accident or laceration or cut, you can get cash back. You've heard of Aflac commercials, if you will. This is just less expensive and better benefits. Unum has the ability just to pay that money directly to you, and that can offset any medical costs that the health plan doesn't pay. But certainly critical illness is something more serious, a heart attack, a stroke, major organ treatment. You're going to max out your deductible in a situation like that. So your $2,800 or your $5,000 deductible, as an example, you are more than likely, you're going to use it all. And so what these benefits do is they provide a cash incentive anywhere between $10,000, $20,000, or $30,000 right to you. So I would argue if you're thinking about this, 10,000 is probably enough, but that would pay for any unreimbursed medical expenses that you had to incur. Again, these are what we call luxury benefits. They both also have well screening benefits. And so if you go just get an exam, they actually pay you to go get that exam. Again, we talked about how to enroll. You all got an email. It's very important to click the registration link first. Once you do that, it will ask you for the new company code, your name. It's completely secure. It's going to know you're in the system, but it's unique to you. And then it's going to ask you to put a username and password. Okay. Please follow the characters specifically as requested. All the problems we've had so far have been just not following. It needs 8 characters or it needs a special character. But all the instructions are here kind of side by side. Then we have some apps, the Meritain app, the CVS, Healthcare Blue Book is the price transparency app we talked about. Slow down, where you go matters. If you just look at the green providers, when you need this, slow down, remember that you have this, pull it up in your doctor's office. Say, can I go to any of these places? Because it already knows that you're in the Aetna point of service 2 plan. It already knows that. It's got your information. It's already built in integration. So slow down and take an opportunity to look at that. And I promise you, you will save, if not hundreds of dollars, thousands of dollars to what you would be responsible for paying. The last thing I would talk about is just one other example. Prescription drugs are still very difficult to understand. Certainly our medical plan covers things. But one of the things I found is my daughter had arthritis at age 2, and it's called juvenile idiopathic arthritis. It's just arthritis for kids. But she needed a prescription that most adults take. Mobic is the brand name, meloxicam is the generic. And we all know, take the generic when if at all possible, because it does the same thing. Well, there's programs like GoodRx that people have seen on TV or in your doctor's office, or even Amazon is doing this now, by the way. Amazon has a discount pharmacy network, as is Mark Cuban from the Dallas Mavericks. He started a discount drug program called Cost Plus. What these are allowed to do is to say, hey, listen, maybe you can go pay cash with a discount and it costs less than what insurance negotiates. So I actually looked at Walmart up in Alpharetta, Walmart in Buckhead, Walmart south of town. And what I realized, and I know you probably won't believe me, that what you thought was the most expensive place in the Walmart in Buckhead was actually the least expensive. And you look at cash price minus a discount. I then looked at, well, what about the CVS versus the Walgreens that was near me? And in that case, the Walgreens was less expensive. Now, that doesn't mean it's any less expensive for you, because you're looking at this saying, well, it's just a copay, Travis. What if you're on the HSA plan? Remember, the HSA plan, everything goes towards your deductible first. But prescription drugs on the $5,000 deductible is just a straight copay. It might only cost you $15 or $35 if you're on those copays. But what you don't know is what actual cost is in totality. So where you go matters, and it's important to kind of slow down and know that. The rest of these are a bunch of disclosure notices that we're required to provide you, and you can read through those at your discretion. One of the second to last pages is information at Arista. We're your employee benefit advisor. We're here to help you with basic questions: how to enroll, how does this plan work, how do I work Healthcare Blue Book again, all the way to I'm having a lot of problems with a claim or something. You can email or call us. And then here are some helpful telephone numbers to all of your service providers. And again, open enrollment is from today until next Wednesday at 5. Whatever changes are locked in at 5 o'clock on Wednesday, and these benefits start 7/1. I'm going to open it up to those on the phone or those of you in the room for any questions, if you're brave enough to ask in a group setting. If you're in the HSA $2,800 deductible plan, remember the IRS decides the rules. All services go towards your deductible. Prescriptions, doctor visits, images, scans, surgeries, everything. If you're in the $5,000 deductible option, you don't have to. See, this says deductible applies, and then it's a copay, versus the other plan to the right, it's just a straight copay. So I would also encourage you to consider Sam's Club or Costco or Walmart or Target. They have $3 generic drugs. Take those lists to your doctor. Say, why do I need to spend $60 or $35? Can I take something that's on this list, which is even less expensive? Okay. Anybody have any questions on the phone?
Yeah, I have a question.
Sure.
So essentially there's two health plans. One is an HSA plan, one is a non-HSA plan. If I have coverage just for myself, and then the rest of, and I have a wife and two kids, and they're covered under my wife's insurance, and she has an HSA plan, can I still use my HSA account to pay for items on my wife's plan?
Okay.
And, yeah.
Good question. If you want to use existing HSA money, it doesn't matter which plan you have for you or your wife. Okay. What the IRS says though, is that you as an individual, whether it's your wife and the kids, or in this case, just you, to be eligible to contribute new money into the bank account called an HSA, you have to be on an HSA compatible plan. Okay. So if you currently stay on an HSA plan, you can contribute new money to it effective July 1st, because this plan goes July 1st to June 30th. If for some reason your wife and daughter stay on an HSA plan through her employer, but you move to the non-HSA, you can't make new contributions, but you can still use all the money in your account that's there. It's just a matter of you cannot put new money for yourself. Does that make sense?
Yeah, so it sounds like if I wanted to go that route, I'd have to get an HSA account through her insurance, an HSA card through her,
Well,
whatever they offer.
Well, you can either choose to stay on United's benefits or you can go on her benefits. That's always an option for you at open enrollment. It's really a personal preference. So if you were thinking about moving to the non-HSA plan, that doesn't void anything from her plan. She and the kids can still make contributions to their plan independent of yours. It's just that you can't put money into it.
Correct. I would just have to pay for, not stuff in the new non-HSA plan. I would just have to pay for the copays essentially, but not using the HSA card essentially.
Well, no, yeah, yes. Remember, you still can use existing money that you have. If you have an account now, if you have an account now, you can use the money that's in the account now. You just can't put new money into the account.
Okay, thanks.
You bet.
Yeah, hi, I got a question here. Can you hear me okay?
Yes, sir.
Okay. I already have the login information from last year. Do I still have to re-register to get in?
Yes, the information from last year is not the same.
Okay.
You got an email. You actually got two emails this morning.
I understood all the process, but I was just curious whether I need to still do it second time. So that means I got to set up a new password and all that.
Yes, the old system is going to go away.
Okay.
We put all your new information, so this will be a lot easier next year. We rebuilt with some enhancements to the system, and so it does require us to start that process.
Okay, thank you.
Thank you. Anybody else?
Yes, I have a question.
Yes, sir.
Yes, so for the two different plans, essentially what you're saying is one is the 2800 one is an HSA making contributions to it. So that's where the 100% deductible comes from. And the non-HSA is basically saying no HSA, but it's just flat rate co-pays for certain services. Is that right?
An HSA compatible plan as designed by the IRS says that all services must go towards your deductible first. You can't have any fixed flat dollar amounts. So you're responsible for all the cost on this plan, and you can pay for those monies that you come out of pocket with a tax advantage account called an HSA.
Right.
If you would prefer to have fixed dollar expenses, which a lot of people like, up front, where you just rather know that it's going to be $25, not $120 or $220, right, for a doctor visit, then this would be the better plan for you, because you would get flat dollar amounts not only for primary care specialist, urgent care, and ER, but also for all of your prescription drugs. The current plan required you to have a deductible first and then these copays. We've taken that requirement out and made this much more favorable for employees. And this also is the least expensive plan of the two. So we've made several enhancements to make this a much more attractive program for people that don't like the unknown expense of an HSA plan.
Okay. So with the HSA, it's whatever, however much services cost, with regardless of what it is, whatever they cost, those are just taken out of your HSA.
Well, so you have two different things. You have your plan design, which is Meritain, right? So you have $2,800 deductible, and you're going to be responsible for paying that $2,800. You don't have to set up an HSA account, but you should. So what I'm showing at the bottom are the premiums just for the benefit itself. If you want an HSA account, you would meet with the HR or accounting team here. They would get you set up with Health Equity, and you would take payroll deduction amounts and put additional amounts into the HSA account for you to take for yourself later when you need the services.
Okay, thank you.
You bet. Any other questions? I appreciate you all very much and your attention and your terrific questions. Thank you very much. This meeting has been recorded and we're going to make this available. So if you need to get this to a loved one or a wife or someone else, we'll make sure that this is made available to you later this afternoon. Thank you all so much. Have a terrific day.